talk about biomarker testing. What is it, first of all, and what are you looking for exactly when you receive the results?
Well, you have to order the results, so you have to know what to order. And we already touched on it a little bit. The genetic analysis of a tumor has become central to picking a therapy. And when I say genetic analysis, that is what you're referring to as one of the biomarker tests we use.
Right.
Unfortunately, it's true that many patients have therapies started without waiting for the results of these biomarker tests. And that really can have a negative impact on their care, because the results of this testing can make the difference between chemotherapy or a pill. I mean, it's a totally diametrically different therapy. So these genetic tests look for things that we call driver mutations. And these are alterations in the genes of your cancer that are not present in the rest of your body. They're not passed down to your children or need to get looked for in your brother or your sister, like some of the breast cancer mutations you might hear about. These are mutations that are present in the tumor that act like light switches, and they turn the cancer on to grow like crazy. And through scientific research, we've discovered many of these actually in lung cancer, where if we can find the specific driver mutation, many of these have specific drugs that can turn that switch back off. And virtually 100% or very close to every patient where we can find that matching drug to their driver will have some tumor shrinkage.
Yeah.
And it's quite remarkable. But we need to do that matching, because these new drugs only work in that subset of patients with that mutation. And that's why it's so important to do that matching. And now we have 8 or 10 of these types of mutations that need to be looked for.